Imagine improving your heart health without expensive equipment, long workouts, or complicated routines. Just you, your body, and one simple movement you can do almost anywhere. If you're over 50, this might be one of the most powerful exercises you've never paid attention to, and doctors say it can make a real difference. As we get older, most people think heart health is only about walking faster, running, or spending hours on a bike. But here's something many don't realize. Your heart doesn't work alone. It responds to how well your muscles, balance system, blood vessels, and nervous system work together. And after 50, one of the fastest ways to support all of that is through a simple one-leg exercise that looks almost too easy to matter. Let's start with what really happens to the body after 50. Muscle mass naturally declines, a process called sarcopenia. Balance becomes less stable. Blood vessels lose some of their elasticity. And the heart, while still strong, has to work harder to pump blood efficiently throughout the body. None of this happens overnight, and none of it means decline is inevitable. But it does mean that the type of exercise you choose matters more than ever. This is where single-leg movements come in. When you stand or move on one leg, your body has to work in a very different way. Small stabilizing muscles wake up. Your core engages without you even thinking about it. Your nervous system sends rapid signals to keep you upright. And your heart responds by adjusting blood flow to meet the increased demand. All of that happens in seconds. Doctors and physical therapists often recommend single-leg exercises not because they're trendy, but because they're efficient. In one movement, you're training balance, strength, coordination, and cardiovascular response at the same time. That combination is especially important over 50, when falls, poor circulation, and loss of mobility become real health risks. The exercise we're talking about today is the single-leg stand, sometimes gently progressed into a single-leg squat or reach. At its simplest, it's exactly what it sounds like, standing on one leg. But don't let the simplicity fool you. When done correctly and consistently, this movement sends a powerful signal to your heart and your brain that your body needs to stay strong and responsive. Here's why it matters for heart health specifically. When you balance on one leg, your muscles contract in a way that helps push blood back up toward the heart. This supports circulation, especially in the lower body where blood can tend to pool as we age. Better circulation means the heart doesn't have to work as hard to move blood where it needs to go. At the same time, balancing activates the autonomic nervous system, the system that helps regulate heart rate and blood pressure. Studies have shown that balance-based exercises can improve heart rate variability, which is a key marker of cardiovascular resilience. In simple terms, it means your heart becomes better at adapting to stress and recovery. There's also a strong connection between balance and longevity. Research has found that people who can comfortably stand on one leg for at least 10 seconds tend to have better overall health outcomes as they age. That doesn't mean balance alone guarantees a long life, but it does reflect how well multiple systems in the body are working together, including the heart. Now let us talk about why doctors prefer this kind of exercise for people over 50 instead of high-impact workouts. High-impact exercise can be great, but it also comes with higher risk. Joint strain, injuries, and burnout. Single-leg exercises are low impact but high benefit. They meet your body where it is, while still gently challenging it to adapt. Another important point is consistency. Heart health isn't built in one intense workout. It's built through small, repeated actions that your body can recover from and stick with. A one-leg exercise can be done daily, even multiple times a day, without exhausting you. That consistency is what creates lasting cardiovascular improvements. Let's walk through the basic version so you understand how simple this really is. You stand tall, near a wall or chair for safety. Shift your weight onto one leg. Lift the other foot just slightly off the ground. You don't need to raise it high. Your posture stays upright, your shoulders relaxed, your eyes looking forward. Then you breathe slowly and naturally as you hold the position. Even holding this for 10 to 20 seconds can feel surprisingly challenging at first. That's not weakness, that's your nervous system waking up. Over time, as your balance improves, your heart and blood vessels become more efficient at responding to the effort. Breathing is key here. Slow, steady breathing helps prevent spikes in blood pressure and keeps the heart rate in a healthy range. Doctors often emphasize breathing during balance exercises, because holding your breath can cancel out some of the cardiovascular benefits. As days go by, something interesting starts to happen. You may notice your legs feel more stable when walking. You may feel less winded during daily activities. Some people even notice improvements in posture and confidence. All of these changes indirectly support heart health by reducing physical stress and improving movement efficiency. What's also powerful about this exercise is how it fits into real life. You can do it while brushing your teeth, waiting for coffee to brew, or watching TV. There's no barrier, no special clothing, no equipment. And because it's so accessible, people are far more likely to keep doing it. Now, some people worry and ask, is this really enough to help my heart? And the answer from many doctors is that it's not about replacing all other activity. It's about adding a missing piece. Walking, strength training, and cardio are still important. But balance-based, single-leg movements fill a gap that traditional workouts often miss, especially after 50. As you become more comfortable with standing on one leg, the real benefits begin to compound. This is where doctors often encourage gentle progression. Not to make the exercise harder for the sake of difficulty, but to keep the heart, muscles, and nervous system adapting in healthy ways. The first and safest progression is time. If you started with 10 seconds, aim for 15 or 20. Over time, working up to 30 seconds per leg is a great goal for most people over 50. You don't need to rush this. Progression should feel calm and controlled, never forced. Your heart should feel gently engaged, not strained. The next progression involves movement, and this is where the heart really starts to respond. While standing on one leg, you can slowly bend the standing knee just a few inches and return to standing. This isn't a deep squat. It's a small controlled dip. That slight movement increases muscle activation and gently raises heart rate without stressing the joints. Doctors often recommend this variation because it mimics real-life movements like stepping off a curb or standing up from a chair. Training the body this way reduces the chance of sudden spikes in heart rate during daily tasks, which is especially important for people managing blood pressure or cardiovascular concerns. Another effective variation is the single leg reach. While balancing on one leg, you slowly reach the opposite hand forward, then return to center. Later, you can reach slightly to the side. These small shifts force the heart and blood vessels to adjust blood flow quickly, improving circulation and cardiovascular responsiveness. What makes these variations so powerful is that they stimulate the heart without the pounding impact of traditional cardio. The heart rate rises gradually, then settles back down, which trains the heart to recover efficiently. This recovery ability is one of the strongest indicators of heart health as we age. Frequency matters more than intensity here. Many doctors suggest doing this exercise daily, even if it's just 1 or 2 rounds per leg. Consistent, low-stress stimulation keeps blood vessels flexible and supports steady circulation. Think of it as brushing your teeth for your heart's small effort, big long-term payoff. It's also important to talk about safety. Always keep something nearby to hold onto if needed, especially in the beginning. A wall, counter, or sturdy chair is enough. This isn't about proving balance, it's about training it. If you feel dizzy, lightheaded, or overly fatigued, stop and rest. Your body should feel challenged but calm. One common mistake people make is locking the standing knee. Keeping a slight bend helps activate the muscles properly and protects the joints. Another mistake is holding the breath. Slow, relaxed breathing keeps blood pressure steady and allows the heart to work efficiently. There's also a mental component that doctors appreciate. Balance exercises improve focus and body awareness. This reduces stress hormones like cortisol, which are known to negatively impact heart health when chronically elevated. A calmer nervous system means a calmer heart. Over time, this simple one-leg exercise can actually change how your body responds to stress. Tasks that once caused a noticeable spike in heart rate may start to feel easier. That's because your cardiovascular system is becoming more adaptable, not just stronger. Before we wrap up, let's bring everything together in a way that feels practical, reassuring, and motivating, because the goal isn't just to know about this exercise, it's to actually use it. If you're over 50 and thinking about heart health, it's easy to feel overwhelmed. Medications, numbers, tests, and long lists of shoulds can make it seem complicated. But what doctors consistently come back to is this: the heart thrives when the body moves regularly, safely, and with purpose. And that's exactly what this simple one-leg exercise offers. It doesn't demand perfection. It doesn't demand intensity. It simply asks your body to show up, balance, breathe, and adapt. Each time you stand on one leg, your muscles help push blood upward, Your blood vessels respond to subtle changes in pressure. Your nervous system sharpens its communication, and your heart practices doing its job more efficiently. All of that happens quietly, without strain. For many doctors, this exercise is less about the movement itself and more about what it represents. It represents control instead of fear. It represents prevention instead of reaction. And it represents the idea that even after 50, your body is still highly capable of positive change. If you're already walking, strength training, or doing light cardio, this fits right alongside those habits. If you're just getting started, this can be your entry point. It's safe, adaptable, and accessible. And over time, it can help reduce the risk of falls, support healthy circulation, and improve how your heart responds to everyday life. The key is consistency. A few seconds today, a little longer next week. One leg, then the other, calm breathing. Steady progress. That's how real heart health is built, not in dramatic bursts, but in small, repeatable actions that your body can trust. So the next time you're standing in your kitchen, waiting in line, or brushing your teeth, remember this. Supporting your heart doesn't always require more effort. Sometimes it just requires better movement. If you found this helpful, take a moment to like the video. Share it with someone who might benefit after 50. Your heart will thank you for every small step you take, especially when it's on one leg.